Okay, are we all ready to start? Yep. Okay. Thank you. Good afternoon, everyone, and welcome to this webinar. My name is Joan Heng, and I'm the Vice President of OAS. So thank you very much for spending your afternoon with us. Just to give you a bit of background on OAS, OAS was founded in January 2014 by a group of colorectal cancer survivors to provide support for those living with ostomies. And I joined OAS in 2020, which was last year, when I became an ostomate due to complications from my ovarian cancer. Currently, I'm still undergoing chemo treatment. As you can see, I'm wearing a beanie because I had to shave my hair for during this chemo treatment. And actually, our president for this OAS is also here. His name is Elil. Elil, you would like to introduce yourself? Yeah.
Hi everyone, my name is Elil. So I'm one of the founder members of the Ostomy Association of Singapore. I'm very happy to see so many of you taking time off to attend this webinar today. Back to you, Joan.
Okay, thank you, Elil. So Elil has given me this opportunity to speak to all of you because I'm a new face in the association. Now, it's actually my pleasure, okay, today to welcome all of you and also the speakers. We have lined up a very good, diverse group of panelists, and I hope you enjoyed this session. This session, as you know, is jointly organized by OAS and Coloplast. So without further ado, I'm going to hand over the session to Sheila, who will take you through the program today and also introduce the various speakers to you. Thank you. Sheila, please. Sheila, you're on mute. Yeah.
Hi, can you hear me?
Yes.
Thank you. Hi, everybody. Welcome to today's webinar. So today's webinar is a joint session, OAS and Coloplast, on better ostomy care for your unique stoma profile. So let me share my screen. Okay, so let me go through today's agenda. So currently we are doing the welcome message, and at 2:10 we will invite Dr. Chu Min Ho to talk about managing life with a stoma. Then after him, we have Miss Doris, our ostomate, to share her journey of parastoma hernia. Then after that, we have Miss Iris Ong. She will be sharing on understanding your body profile using the body check tool. Then we'll have a short fun quiz around 5 minutes before we hand over back to Miss Joanne for the Q&A and closing. So without further ado, I would like to invite Dr. Chu Min Ho. He is the Senior Consultant at the Surgeons Private Limited at Mount E Novena. He will be sharing with us the managing life with a stoma, caring for oneself better. Chu?
Yeah, thank you. Please allow me to share screen. Okay, hi everyone. I presume you can see the screen. So thanks for the kind introduction. And also thanks OAS, the President Elil and Joan as well for the wonderful organization of this session. And thanks Coloplast for the invitation. My name is Min Ho. I used to be in SGH, and then I went to Sengkang General Hospital when it first opened in 2017. I was the head of department there of surgery, and I'm a colorectal surgeon. Sengkang has been open for about a couple of years, 3 to 4, and I then did more admin roles, and now I've gone out to private practice, and I'm now in Mount E Hospital in Mount E Orchard. My topic today is basically living with a stoma and some of the concerns that you may feel, and I'll try to address some of them, some very physical, some very superficial, and some very intimate as well, that I hope I'll be able to answer most of the questions you have that sometimes you feel not able to voice out. And also feel free to ask questions at the end of the session that I can help. So my outline, what is a stoma? What are the types of stoma? And also to question, why is a stoma needed? I think a lot of times, many patients require this understanding as the surgeon counsels for surgery. Why are some stomas permanent and why are some temporary? Okay, some of the concerns: what can I do with a stoma? What can I eat when you have a stoma? And what can we do as healthcare providers to help you get by? Okay, so what is a stoma? Stoma in Chinese, we call it 造口. It's an opening on the belly that allows your digestive or urinary system to let waste come out. Okay, and in this, it can be sited in the tummy wall. It can be on both the right or the left of the tummy. Intestinal waste is feces or poo-poo. Okay, and it usually sited here, either the small intestine on the right or the colostomy or a colon. Can be both various sites. It can be on the left of the colon, can be on the right colon. It can even be the horizontal colon or the transverse colon. And so you find patients with stoma actually may have different sites at various places, which is not necessarily similar in many patients. Also preference of the disease that you have, the anatomy you have, and also the surgeon's preference sometimes. Okay, so an ileostomy looks like that. It tends to be a little bit more spouted, and the reason is because you want the contents to come out without irritating the skin, which can often lead to very uncomfortable rash that requires a lot of care and wound help as well. A colostomy, it tends to be on the left most of the time. It tends to be a bit flatter, and the contents, of course, is solid brown stools, and a lot of times this may be permanent in nature. Okay, and so sometimes we have a urine bag. This is when patients undergo radical, what we call bladder or cystectomy, and you connect the urine pipes called the ureter into the small intestine, and this comes out, as this picture shows. We remove the bladder. A lot of times it's for cancer. Okay, and you connect it to a small intestine, and urine then comes out from the small intestine here, and it looks like that in the picture on the right as well. So there are many kinds of stoma: ileostomy, colostomy, and urostomy as well, and care varies differently. Now, when a stoma is first created, and this is brand new in the operating theatre, you find some of the surgeons will insert this thing called a rod underneath. This is white structure underneath the stoma. This is temporary. Right? It's meant to hold the stoma up to prevent it from dropping back in the tummy. Some of the patients have quite big abdominal wall. Some are very obese, and it's quite difficult to pull the colon completely out of the abdominal wall. And sometimes we're worried about retraction or prolapsing back in. So this rod is usually kept for at least 4 to 5 days before we remove. This allows the sutures to then take the stoma to then hold onto the skin proper before we remove the stoma rod to allow it to heal. And the picture below looks like that after a while. There's sometimes 2 openings. Proximal means the end connecting to the mouth coming out, and that's where all the waste products come from. Distal means this goes down towards the anus itself. And usually the functioning one is the proximal end. That means you see contents coming out from the proximal end. Okay, so this is basically 2 ends of the intestine. In this graphic here, you can see that. And one end where the blue arrow comes out, that's the proximal end. And usually contents go down to the distal end itself. So this is what the stoma creation looks like. Some have one end, which is the end colostomy. Some have 2 loops as well. And that's what we call a loop ileostomy or loop colostomy. Now, this question that takes a long time to counsel many people and patients as well as caregiver: why is a stoma needed? Now, in many of the operations that we do, rectal cancers are the predominant colorectal cancers for all colorectal cancers in Singapore. That in numbers about 40%. And in the surgeries for colorectal cancer, a lot of the cancers are very close to the anus where the gangmen, where you pass motion from. When we remove the tumor, We then have to join the top end of the intestine down as close to the anus as possible. And sinus is very, very close, and the margins are required. So you have something like 4 to 5 centimeters from the skin of the anus. Now, the risk of what we call an anastomotic leakage, that means the separation of the intestine, is quite high in this circumstance, especially made worse if you had radiotherapy or chemotherapy before. And the risk sometimes can be as high as 10 to 12%. If it leaks, feces come out, it's life-threatening, patients can die from that. And that's why we want to avoid this problem by doing a temporary stoma. And in this case, while it does not prevent a leakage, and leakage can still happen in this creation, what it does is by diverting the stools away, the amount of infection therefore is reduced. And so the patients can recover better, and the stoma can still be reversed when the leakage is resolved. Okay, so that's one element of why a stoma is needed. It's a temporary stoma to protect the anastomosis that we do. Okay, and this is before the connection or the anastomosis, where we join the descending colon down to the remaining colon. And this allows time to heal. Usually for patients, when we close the temporary stoma, roughly about 3, sometimes to 4 months, but it depends. If the cancer is advanced and patients need chemotherapy after the colorectal surgery, we might have to close the stoma after completion of chemotherapy, because we want to have the patient have the adequate completion of treatment to prevent cancer recurrence. Okay. Now for this, where the stoma is permanent, okay, this is a colostomy like we mentioned. There's some circumstances. One, the cancer is involving the muscle of the anus, okay? And in this case, it is not technically possible to join the intestine to the skin for 2 reasons. One, there's no muscle, so there's no control. You're not able to then hold off feces or gas, and it just seeps out and soils your undergarment. So it's not possible. 2, for adequate cancer clearance, we therefore need more margins. We try to achieve something like 2-3 centimeters, but sometimes it's just very, very narrow. And in this circumstance, we have to make the hard decision to then remove the anus and have a permanent colostomy bag. Okay, so this is what we call permanent colostomy. Now, there are many concerns, and we spend quite some time discussing. The surgeon will spend, the stoma nurse will spend, and relatives also will ask what we can do and what are some of the concerns. Many times, what can't you do with a stoma, and what can't you eat with a stoma? And here's a list of things you can't do. Nothing. You can do everything possible, okay? It just needs some adjustments, and there needs to be both some social and physical adjustments, but technically everything can be done, and everything you can eat as well, okay? So many times, patients are very worried about travel, in the era where we can travel, obviously, and many we will advise to bring spare bags. When you go up in the air, the pressure does change the air somewhat, but it's okay, and you can empty the bag on flight. Just bear in mind, sometimes after a while, when you're used to the frequency of how stools come out, you might need to empty it every 4 to 6 hours, and to do so prior to takeoff or in between, especially for long transatlantic flights to the States or Europe as well. Okay. Exercise certainly is necessary and it's okay. And you see many of this on internet, where very young patients with permanent stomas, for whatever reason, are able to work out and be fit and carry on the same quality of life and same physical health as well. Okay. You can run, you can gym, you can swim. Now, of course, there are some garments that you may have to wear to support this, to hold the stoma in proper so that the gas doesn't bulge out. And there's various heights for the different body shapes as well. You can swim, okay? This requires for you to empty the products off. I will often recommend a patient to wear a one-piece wetsuit, for example, to keep everything in, if you don't mind that, because of course we don't want to wet the bag too much that you have to change it too frequently. Okay, and there are also some garments that can hold up. You can wear tights, for example, that can overlap the bag and keep everything in. And of course, the duration is important. You can't be in water for more than 2 to 3 hours, but certainly swimming, going on the beach is possible with a stoma bag as well. Okay. And these are things you can't eat. And the good news is you can probably eat everything, but like all patients or all normal people, okay, without stoma bags, sometimes your bowels are more sensitive to curry, to spices, to oily food, to lactose, and that is the same with stoma. So Some of them who experience all this may go to toilet or empty the bag more often if you eat things that you are already more sensitive to prior to the creation of a stoma. Okay, you can eat everything in Singapore that is palatable to your taste. The char kway teows, the fried Hokkien mee, the pratas, the nasi padams, those are okay. But obviously, as all healthcare providers, I'm also obliged to tell you everything in moderation. Enjoy what you can, but don't overeat and indulge, obviously, for other health reasons like diabetes and heart. Okay, but everybody is different. Huh? A young, a moderate, a medium age, or an elderly, we all have different practices, different ethnic groups, different religions, different races. We all have different practices and diet as well. Okay, but some modifications will be necessary. Now, straight away after surgery, the dietary counseling we tend to do is we want you to have a low fiber diet. There's several reasons for this. Fiber tends to form bulk. Bulk can cause blockage because your intestines are a little bit swollen after surgery, what we call edema. And this blockage can cause very troublesome symptoms like cramps, or worse still, you can cause vomiting. They need to put a nasogastric tube in temporarily. Okay. Now, every surgeon and every hospital has different practice. For me, I would advise a low residue diet for about 2 weeks, followed by a low fiber diet for 2 weeks. Some surgeons will then go straight to a low fiber diet for about 4 to 6 weeks. And again, it depends from patient to patient. For vegetarians, we also can advise, and you can also have a vegetarian that is low in fiber, more tofus, but less fibrous vegetables as well. If a stoma output is too watery, okay, you can increase the amount of carbohydrates in your stoma, more white rice, more pasta, and potatoes without skin. This tends to clump your stoma contents together, but bear in mind these also have high sugar content and not advisable if you're diabetic as well. If your stoma output is too hard, the stools are too soft, it doesn't come out easily, then do take more fruits, vegetables, or even fruit juices as well. And of course, adequate hydration is important. I will also advise to have adequate exercise, walking, because that improves your gut health, improves circulation, and improves digestion as well. And those are the standard steps to prevent constipation as well. If you have too much gas, and sometimes you find, excuse me, a bit embarrassing because it comes out spontaneously, things like beans, these are very gaseous, or cabbage or cauliflower. Some of the evidence suggests cauliflower has this component called sulfur, and that tends to cause a lot of bloatedness. High sugar drinks, because of digestion, also lead to a lot of gas formation. Even chocolates, ice creams, and all that tend to produce a lot of gas as well. If the smell is very awful, you feel, then take less eggs, fish, garlic, onion, and cabbage. And these also cause bad breath in general. So that may be helpful in reducing a lot of bad odors coming out from the stoma itself. This very small section is a little bit of problems of stoma, or complications of stoma. The peristoma hernia is when there's a weakness in the tummy wall. And so this is quite uncomfortable. It bulges out. Very often you find surgeons are a bit reluctant to operate because it's not so easy to repair this. You might have to resite the stoma. You have to put foreign material called a mesh. And success rate is usually only about 60 to 80%, depending on the premorbid and the complications and the health of the patient. But a lot of times it's from the weak abdominal wall. Now, very early on, sometimes the stoma is not healthy, what we call necrotic and turns black. This usually happens immediately after surgery, and we have to check it in the ward, make sure it's viable. I know there are cases in Singapore where the stoma turns very dusky and black looking, and we have to then redo that. That means the blood supply is not healthy to the stoma already. When the stoma drops out too much, this is called a prolapsed stoma, and you find it very uncomfortable, unable to put your bag on top, for example, or it feels very, it can get ulcerated. A simple measure is to apply just sugar, the packet of sugar you put in your coffee, apply some wet gauze on top of that, and this draws the fluid out from this stoma itself to allow it to shrink in size, and then you can then push it back in. So this is a temporizing measure. But of course, if it's very prolapsed, it turns very beefy in color, a little bit ischemic, then please go to A&E, because then it means the blood supply is getting cut off, and to salvage it and to save it, you might need surgical intervention. Okay, so something like that, apply a lot of sugar, it turns the stoma, lets it shrink, and then lets it reduce back gently into the tummy itself. And of course, we have to apply wafers. The skin itself can be very sensitive. My patient had a very bad allergic reaction and then required steroids for almost 9 months from this. And so it's not easy, and we understand that. But most of the wafers are hypoallergenic. It doesn't cause so much irritation. And I think Coloplast and the team has continuously improved better products to improve better health and better care for the stoma itself. Very rarely, okay, the stoma becomes too tight, and this can happen, but sometimes in chronic diseases such as inflammatory bowel disease, and the disease process causes overreaction and scarring itself. But of course, this needs revision and needs surgery, otherwise feces can come out. Skin, we have to be very careful and do consult your stoma nurse or the physician. When it's very itchy, it sometimes may be just fungus and it's just poor hygiene around that site, and it requires a bit of treatment with topical creams, and that should work out quite well. The skin you can see around here is due to some urine that's sometimes for the urostomy, and it tends to be blackish with white crystals. And so we try to make the wafer a little bit bigger than the stoma to prevent the crystallization of the product around the urine site. Okay, and excoriations itself. Now this topic, okay, intimacy, especially for married couples, they're very concerned. Can they still do it? There's some common myths, okay? Having sex will spread cancer to my partner, and that's obviously not true, okay? Body movements during sex can hurt the stoma, and again, that shouldn't be a problem. And of course, let yourself heal after surgery, and intimacy can still continue once everything has healed after surgery, okay? And it's impossible to look attractive with a stoma, and that sometimes that everyone feels very worried. While it's inconvenient and we accept that, it might be difficult, of course, to walk around with a bikini initially because of the bag. But of course, there are many people who have modeled with this. They're very proud to have it and they live with it. And I don't think this is something to be ashamed of. It's just what we go on through life. Just like the Paralympics now that Tokyo has. Many people thrive and they live life to the fullest after that with a stoma. Okay, so in closing, all right, an ostomy isn't a reminder of what you suffered. Okay, it means you survived everything and you're still here and you're able to carry on as back to normal as possible. Okay, so don't look at it as a stigma. Okay, be realistic that everything can go on. Life can go on. You can eat everything. You can travel. You can have children. You can do sports, and it can be just as good, if not better, without the cancer that you have, and it's a cure that you have, and the life has been given you to enjoy to the fullest. Okay. With that, I'd like to thank you for your kind attention, and I pass the time back to the host for this. Thank you very much.
Thank you, Dr. Chiu, for the very informative session. All right, so that was Dr. Chiu Min Ho, the Senior Consultant from the Surgeons Private Limited at Mount E Novena. Next, we have an ostomate who is here to share with us her peristomal hernia journey. So, give me a moment, let me share her slides.
Hi, good afternoon. Nice to see all of you here. Firstly, I would like to thank Coloplast Singapore for inviting me to share my past experience of heavy peristomal hernia. This is me. I am Doris, working as a maid agent and have been volunteering as a stoma patient ambassador in SGH for the past year. I'm wheelchair bound with multiple medical conditions. This is my journey from the start of my injury. In 2005, I had a serious fall, and which caused an injury to my spinal cord. In 2006 and 2008, I had two major surgeries done on my cervical spine. My stoma was created on 2017 April, and I have a surgery for peristomal hernia in 2019. Besides this surgery, I went through many other minor operations. I thank God that despite my disability and all surgery, I did not feel down in my life. In fact, I feel blessed as I journey along the path that many of you have experienced too. There are three objectives that I will be sharing with you today. Firstly, my past experience with peristomal hernia. Secondly, the symptoms I had experienced, and lastly, how to prevent reoccurrence of the hernia. In these pictures was taken in 2017 October. A stoma was created on the stomach area that allows the waste to pass into the bed. After stoma was created within a year, I discovered my stomach getting bigger. Initially, I thought that I was putting on weight. It was manageable and unnoticed at first, as it didn't cause any great discomfort. I remained in this condition for almost 1.5 years before the hernia gradually got bigger around my stomach, and I felt great discomfort. Here you can see my stomach was bulging like a huge mountain due to the build-up of the hernia over time. And I feel a lump below the stomach. This is actually part of the intestine being pushed outwards near the stomach that forms the hernia. I was told by my surgeon that stomach hernia is a common complication that happens to stomach patients as a surgically made opening can weaken the abdominal muscle and tissue around the stomach. In most cases, they are manageable. However, in some cases, surgery might be necessary. Normally, advice from doctors will be to minimize symptoms, avoiding surgery if possible. As shown here, you can see two pictures. This picture was taken on 2019 September during my surgery. Picture 1 was taken before the surgery, where you can see white net was found around the stomach with a few small bowel strokes. This may block the blood flow and could lead to the loss of blood supply, which can be life-threatening. Picture 2, at this point, emergency surgery was required to untwist the intestine and to restore the blood supply so that the obstructed parts of the intestine will not be permanently damaged. It was a very painful experience for me. Before the surgery, I was advised by my surgeon to have a CT scan to determine the severity of the conditions. And you can see in picture 2 was taken after the surgery, and where the mesh was placed over the stomach, over the stomach, and below the abdominal wall. Eventually, the mesh fused the muscle and the tissue together. This will create a strong area in the stomach and prevent the reoccurrence of the hernia. Next, I will showing you the pictures before and after the surgery. This is a picture taken before the surgery, where you can see the bulging of the stomach, and this is after the surgery, when you can see the stomach is flat. And here you also can see the stomach was bulging. That is before the surgery, and this was taken after the surgery. I have encountered some symptoms, but it may happen differently amongst individuals and do not apply to all, as individuals have different medical conditions. As for me, I have a sudden change in my bowels habit. Like I have lesser bowels, and I have a watery diarrhea, and at times I will feel the acute pains that comes on suddenly and get severe, bloated stomach, and sharp pain around the stomach. This made me feel that at times I feel fullness and tightness around the affected area. And here you can see that I have a bulging stomach around this area. And sometimes when you cough, you will feel the sharp pain around the stomach. And when you sneeze. At times I feel vomiting and nauseating, and I couldn't pass out even gas, and it made my stomach very uncomfortable. This symptom may cause one to feel down and depressed because when I had the pouchy stomach, I feel it's so shy when I in the public that my stomach is so big. However, thankfully for me, I did not let this symptom affect me, and I continue to stay positive and stand firm to my Christian faith. And how do I prevent the reoccurrence of the hernia? Firstly, avoid overstrain. When overstraining can be happen when once doing certain exercise like the lifting heavy object, using force when getting up from bed, these strains may cause the muscles around the stomach to be weakened and in due time hernia to be formed. And try to gain weight. Try to lose weight, sorry. And try to exercise regularly. Exercise regularly is to strengthen your abdominal muscle. So at times, when one cough, sneeze, try to support your stomach and the abdomen to reduce the force used by the muscle around the stomach by using two hands pressed to your stomach to prevent pushing pressures on the abdomen. Thus, this weakening the tissue around the stomach. You also can monitor your stomach frequently to ensure that it's functioning normally. Lastly, you can also wear the support garment. And these are the garments that I have been wearing that have been helping me to support the muscle around the stomach for preventing the hernias reoccur again. And last, I would like to give everyone a tips. This is how I have practiced myself to do these 3 steps of the massage. And this will able to help you to get rid of the bloated stomach and gas. It's not to everybody, but it's just as for me, it is very useful for me. Things to take note after the surgery of the hernia is to be happy and think positively. Hernia can reoccur again after the surgery if one does not take good care of it. These are the stomach accessories that I have been using for the past few years till the present. And lastly, I would like to thank you for your time and for my sharing may benefit you. Keep on fighting in our journey till the very last day. Thank you.
Thank you, Ms. Doreen.
Yeah,
Thank you so much.
Sheila.
Yes.
Yeah,
Yes.
Joan. Doris, you were moving the slides quite fast. Can you go back to slide 15 where you did the massage? That I think that one was very fast. Maybe most of us didn't get it. So can you explain this a bit? How you do this massage?
Okay, as you showed in this picture one, firstly, you can see on the picture that you're using these 2 hands and to press the lower down of your abdomen. And on the second picture, you can see the massage tool. You are trying to press the apply a pressure to your belly from the side with your hand and keep the pressures for the 5 seconds and repeat it 15 times. So you see, hold on, massage tree, the picture tree, the massage tree, you apply a slight pressure on your abdomen and massage the area with the circular movement. Keep on massaging for 2 minutes. It does help it. Finally, at the picture tree, you will feel some gas will be coming up from your this stomach, and that will release the tightness in your stomach. Is that clear?
Yeah. Okay. Thank you very much,
Okay, thank
Doris,
you.
for sharing. Yeah. Sheila, back to you. Thank you.
Thank you. Thank you, Ms. Doris, for such intimate sharing. And so if there is any questions for the speakers, you may post the question in the chat box or the Q&A chat box, and our panelists will answer them towards the end of the session. So the next speaker, we have Ms. Iris Ong. Okay, Ms. Iris Ong, she is our Coloplast clinician nurse, and she is a very experienced stoma nurse for 16 years. Today, she will touch on understanding your body profile using the body check tool. Ms. Iris?
Sheila, you have to put it, yeah, to presentation. Thanks. We are seeing, okay, great, thank you.
Okay, thank you, Sheila, for the introduction. Hi, very good afternoon to everybody. My name is Iris. So I'm a stoma nurse working for Coloplast. So today I'll be presenting on this topic of body profile check too. So as all the stoma patients with all the individual stoma, not all stoma is the same. I always tell my patient, not all stoma is the same. This also goes with the same as body profile. Not all body profile is the same. Okay, so I'll run through the body profile check using the website that there's a video in the website, so that you can actually also go into the website and do a body profile check. Okay, so if you see in my picture, okay, this presentation picture, you have a regular stoma on the left, okay, an inward stoma, we call it a medical term, we call it a retraction stoma, or the outward stoma, as in a parastoma hernia. Okay. So in this video, I'll run through the checklist of the 8 questions, okay, that you can find in our Coloplast.sg website. Okay, so you will look under this ostomy cell assessment tool, you check it in, okay, and then you will go to this page where it show you the cell assessment tool. Okay, so you click on this, check your body profile, try body check. So as you click in, okay, you will see this page. It will tell you that it will take about 5 minutes, okay, to complete the body check. There's total of about 8 questions, which I'll bring you through one by one. Okay, then you click on the try body check now. Okay, and then you will go to the next page. Okay, out of the 8 questions, the first question, you will ask you to assess the form of the stoma around the area around the stoma. Is it regular, inward, or outward? Okay, for example, okay, let's say I'm a stoma patient, I have an inward body profile. So this describes me. You tick on the checklist, and then you will go to question number 2. Is the form of the area around the stoma, is it uniform? Okay, is it like not uniform all across the skin, or is it variable? There's any skin fold, any sagging skin. Let's say this best describe me. Okay, the form is not consistent. I'll do a checklist. And then now you go to question 3, you will ask you the area around your abdomen or your abdomen area, the skin, is it soft or firm? Okay, so if let's say I have a soft profile, you do a checklist. Okay, number 4, is it any superficial or deep fold? Example, when I bend, when I sit, I have a very deep skin fold, so you do a checklist. And then the next question, they will prompt you to, is your stoma above the bending line, at the bending line, or below the bending line? Okay, let's say I have a skin fold, and then when I bend, the stoma is at my bending line. Okay, the next question, okay, they will ask you, is your stoma above the skin level? Is it flush or below the skin level, as in the third picture, like it's retracted? So let's say I have a stoma with flush skin level. So I will do a checklist, and it will prompt you the next question. Is your stool, your output thick, form stool, or is it a pasty liquid stool, or is it a form of urostomy or urine stool? Let's say I have an ileostomy and I have a very liquid stool. Okay, then they will also ask you, what kind of housing system are you under? Are you using 1-piece or 2-piece system? Then you can choose. Let's say I'm using a 1-piece system, flat 1-piece system. Then I do a checklist. Okay. So when you do the checklist, this system, it will prompt you or recommend you what kind of, based on your body profile, what kind of bag is suitable. Let's say, okay, I've done my body profile and it showed me that actually I'm suitable for a 1-piece convex. Okay, So this is a one-piece convex shown here. Okay, so if you want to select a sample, like you want to try the sample, you can actually tick. Okay, and then you can key in how many piece you requested, what kind, well, one piece, two piece convex, and we'll be able to send you the sample. Or let's say if you need somebody to do a home visit and actually contact me, there's a contact number on the website, and contact me. I can do a free home visit to help you to troubleshoot. Okay, so this is our Coloplast website. You can go to this website, visit coloplast.sg/OSAT. Okay, then you'll be able to go straight to this body profile check. Okay, I give you some time, maybe you can take picture or write down this website. Okay. Okay, so I'll also share with the audience two of my case study using the body profile check. Okay. So the case study number one, I have this patient. The stoma is very nicely created. Okay, with the stoma very round. Okay, is a ileostomy. So with the stoma opening, you can see it's right in the middle. Okay, so the stoma is considered regular and is very uniform. Okay, there's no bulges, the abdomen is also very firm. Okay, no soft skin, no creases, superficial, and is created below the bending line. So this patient have a stoma being marked or cited before surgery. So as a stoma nurse, we always reinforce and re-emphasize that it's very important to have a stoma mark. If let's say the op is an elective op. Okay, of course, sometimes in emergency surgery, the stoma can't be marked. Okay, so the best case scenario is if the stoma is above the bending line, you won't have experienced any skin fall or creases, and then it won't lead to leakage. Like in this case, the stoma is very nicely and very well created. Okay, and the stoma is above skin level. Okay, so ideally, every stoma should be about 2 to 2.5 cm above the skin level. Anything below that, you might have a flush stoma, or sometimes the stoma actually, as time goes by, the swelling will go down, stoma will shrink, and then at the end of 2 months, some patient from flush stoma may experience a retracted stoma. Okay, then you cause like leakage and skin issue. Okay, so in this case, my patient have an ileostomy, so draining the output is liquid to pasty stool. So for his case, I let him choose a one piece or two piece flex system. But patient said that he changed his stoma bag every about 4 or 5 days. So I suggested a one piece system for him. Okay, so it's more soft and he prefer a one piece system. So this one piece system will look like this. Okay, so the pouching is a one piece system. This patient change every 4 to 5 days. Okay, so this is a one piece system. Okay, and two piece system flat also will be suitable for this patient. So usually we'll adjust to what the patient prefer and their lifestyle. Okay. Okay, for this case study number 2, okay, this is another case of my patient. As you can see from the picture, okay, patient had an inward body profile. Okay, and the abdomen is soft. And when she bend, I ask her to like crouch a bit bend. You can actually see a very deep skin fold at the 3 o'clock and 9 o'clock direction. Okay, and the stoma is created at the bending line. Okay, it's not below the bending line. Okay, and just the stoma is also not very spouted, not very budded. It's actually created below the skin level. This stoma is quite new. When I saw it, it's about maybe 2 weeks old. Yeah, so when the inflammation, when the stitch start to dissolve, the stoma was become more flush or retracted in. Okay, and this patient has a watery to loose stool. She has the ileostomy. Okay, so I have to use some like skin barrier, like powder spray, and I use a paste to level up the uneven skin fold. So for this case, I recommend to use a one piece or two piece convex. Patient prefer a two piece convex. Okay, and then I also advise her to wear a stoma belt for better convexity. As you can see from the picture, her stoma opening is not at the middle. It's right at the end here near the skin, at around the 7 to 8 o'clock direction. So if you don't use a convex system, right, most likely if you use a flat or one-piece flat, most likely it will leak. Okay, so this is what I do to troubleshoot the leakage. Okay, I apply the stoma paste at the 9 o'clock, 3 o'clock where the deep skin fold is, and I put all around. Okay, so I advise the patient to wear a convex two-piece system, okay, because she wanted to wash the bag. So it's the two-piece system enable her to take out the bag and then wash. And then I also encourage her to wear a stoma belt for better support, and she feel more confident, and also for better convexity. Okay, so this is the recommendation. If you do the body profile, they will recommend you to use a one-piece convex, okay, or a two-piece convex. Okay, so this ends my presentation. Okay, so now I will pass on to Sheila to do the quiz. Okay, thank you.
Thank you, Ms. Iris. I hope our participants have taken note of the website earlier for the body check tool. So once again, it is at visit.coloplast.sg/OSAT. Okay, so next on, we would like to touch a bit on this new campaign that we have, this new initiative. So Coloplast is currently looking for brand ambassadors. We are looking for ostomates that would like to make a difference and be an inspiration to other ostomates. So if you have received our flyer, or if you have received our WhatsApp, we would have the invite. So it is in the invite. If you would like to join us, you can go to the QR code, or you can actually write into our email at sgcare@coloplast.com. So what happens is when you join our brand ambassadors, you will be joining the rest of the ambassadors from around the world and be the first to try the new Sensura meal in Singapore. So some of the brand ambassadors' benefits are you get to be part of a brand ambassador community. You have an opportunity for speaker sharing engagement. You bring an inspiration to other ostomates. And also you'll be the first in Singapore to try the #1 ostomy brand in the world, Sensura meal. And with it comes with a VIP pre-launch trial. Okay, so the QR code is on the screen. So you can scan with your digital device, or in fact you can screenshot it, and you can scan it later on if you do not have it. If you do not have the flyer with you, okay? Okay, moving on, we come to fun times. So right now, we would like to invite keen participants to join us for a quiz time. But in order to join this quiz, you've got to have a separate digital device. So maybe you can borrow another smartphone or use your computer. Just log into this website, www.menti.com. Okay, or you can scan the QR code on the screen. The code to key in is on screen. It is at 36819274. Okay, so we will leave this screen for a while. Input your name as the nickname so that in the event if you are the winner, we will be able to identify you easier. Okay, so just a bit more information about these questions. There will be a total of 5 questions, and they are based on each of our speakers that shared earlier. Each question will appear in the digital device that you use to join for the quiz, and you will need to answer it in the device before the countdown ends. So the countdown is usually like 15 seconds each question. Okay? And 5 winners with the highest points will get a goodie bag each from Coloplast. So a hint, you have to answer fast, answer correctly to get more points. Okay, can we get participants in? We'll just give a couple of minutes, okay?
Sheila, have you activated?
Yes, I have activated. Can you retry? Yeah, click again. I can see participants in already. So we'll give it like a minute more before we start the quiz. Okay, I hope y'all can log in. I hope y'all are able to get in successfully because we are starting very soon. All right, is everybody ready? All right, we're gonna start now. Well, I can see a lot of participants. All right, the first question. Which of the following is a common stoma complication? All right, the correct answer is peristomal hernia. Let's look at our leaderboard. Remember, the top 5 gets a prize. Question 2 coming. Regular, inward, outward are the 3 body profiles used to describe the form of the area around the stoma. Is it true or false? The answer is true. Let's take a look at our leaderboard again. Oh, we have some shifts. Number 1 currently is Azza. Next question coming up. Question 3. Which body profile that you see on screen best describes this image? Is it a regular, inward, or outward? It's great. Most of our participants got it right. It's outward. All right, let's take a look at our leaderboard again. All right, we have Azra still at the top, followed by Tina, Audrey, Lee, Peggy. All right, here comes question 4. Which type of stoma is for draining urine? Is it ileostomy, urostomy, or colostomy? It's urostomy. All right. We're coming to the last question. Question 5. Low fiber or residual diet is encouraged for 6 to 8 weeks post-stoma surgery. Is that true or false? The answer is true. All right, let's see who is the winner. Wow, we have Azza, Audrey, Tina, Lit, and Meichi Go, the first 5. Thank you so much for participating. Will these 5 winners please key in at the chat box area? Then we'll get in touch with you after the session. All right? Okay, so right now, I'm going to pass over to Joanne.
Okay.
So yeah, for you to do the Q&A session as well as the closing.
Okay, thank you, Sheila, for conducting the quiz. I think that was fun. All right, now we do have.
All of you have fun.
Yes, they have fun, I'm sure. So we have a couple of questions from our audience here. So I think I will direct some of these to Dr. Chiu. So one of the questions is about redness around the stoma. How do you identify how much redness or irritation should we be concerned?
Thanks. Can you hear me? Yeah, okay.
Yes.
Yeah. Okay. I think that's the wide range now. The standard redness from pressure of the wafer is usually there when you remove that. I think the challenge is when it starts getting painful and itchy. And sometimes when the skin breaks, you get blisters, or you can also sometimes see small spots of bleeding around that site, especially when the skin is very fragile. And this comes with any normal tapes and micropores that we use for other dressings per se. I think this takes some time to adjust. A lot of the Coloplast wafers are hypoallergenic and it's very good to apply on the skin itself. I think if the paste and the powders just don't work and it's getting more and more painful, then we have to consider there's an underlying infection of the skin, either fungal or bacterial, that might even need some treatment or antibiotics, for example.
I
Thanks.
see. Okay. The other question is about sleeping flat on your tummy. Will that affect stoma?
Okay, that one very tough question. I know some, well, not many people sleep on the back. Many people like to sleep on the side or on the front. The short answer is I really don't know the back itself, right? I think a lot of it is the size and all. But if you're a prone sleep habit, then you might want to make sure the bag is completely empty. Because it's very easy to dislodge it as well. And maybe if there are other opinions, Joan, what is your experience, and you want to share with us how you sleep as well? Yeah.
I can't. I can't, lie flat on my tummy. No way. And the other thing is, actually, I also try to do yoga, and there are some poses that really needs me to lie flat on the tummy. I also can't do it. Yeah, it's kind, it can cause some discomfort to me. Yeah. So not for me. I'm not sure about Elio, whether it's possible.
Right. So I think I refer to what Dr. Chu mentioned earlier, that it also depends before you go to sleep, if you empty your bag and your dietary habits are such that you eat early, let's say by 8 o'clock, so that your bowels clear before you go to sleep. Right. So I can lie flat on my belly when I go to sleep. That is when I eat early and I know that, I clear my bag before I sleep. And nothing comes out till morning. And also the type of food, because if you have food that is gas, that produces gas, then it will also bloat your back. And then when you lie flat on your belly, then, it gets dislodged. So a number of factors involved. But again, everyone is different. So you need to see if your bag, the way your output comes out, how much gas you produce and stuff like that. Then you decide for yourself. It's a bit of trial and error as well. But after a while, you'll know whether you can or not. Yeah.
Yeah.
I just want to add, I think sometimes lying prone itself is quite challenging with a bag. And you might have to switch it a little bit by maybe applying a small bolster and pillow such that you're not completely prone, but slightly elevated such that there's a bit of space in between. I think that sometimes it's also okay and also acceptable and still comfortable to fall asleep. And that's what I advise as well. Thanks.
Okay, thank you very much. I think the next question probably is for Iris about from this lady that about the stoma bag, like on the second or third day, the carbon filter at the top gets wet. And even she pasted the sticker, and sometimes the paper will drop inside the carbon filter. So yeah, and it causes bad smell. Any solutions, Iris?
Okay, for the bag, right? Okay, there's this little round sticker you find in the box. Okay, you supposed to paste at the back entrance. You lift up a little bit of the sleeve and then you put the sticker there. But sometimes a lot of patients feedback to me like after 2 days, right, the filter get black. So the filter is actually a carbon, is a charcoal. So once it get black, that means the filter is already get choked up already. That means it's no use anymore. So that means its purpose is to absorb air and smell. So that's when the smell will start coming out. But sometimes it's very hard to control, especially in the case of ileostomy. When you lie down, right, that's when you're up or sitting up, because due to gravity, it will flow down. Even when you lie down, okay, the feces will tend to backflow inside. So that's where the filter become black. So either maybe change the bag more frequent, maybe every 2 days. Yeah. If not, before lying down, I always advise my patient, you empty your stoma bag before lying down. Yeah. So this is like example. Okay. So this is the filter, and this is the filter, right? There's the filter. So before wash your bag or before you go shower, you see there's this filter at the back here. You lift up this white piece here. Can you see? So there's this sticker. Okay. So before you wash or shower, you put the sticker here, right here, like that. Then you cover like this. Okay, then you go for a shower. Okay, or wash your bag. After you shower or you have completed washing your bag, okay, you have to take out the filter. If not, you will block the entrance. Okay, Okay, then to preserve this filter as wide as possible. But sometimes from here, right, the feces in back flow up. This one cannot be helped. It's a little bit challenging. Yeah. So I always tell my patient, before you sleep or before you lying down on the bed, you empty your pouch first. So come in October, we are going to have a new range of stoma bag called Mills and Sura, where the filter is all round one. Then you will solve all this problem already. Yeah. Oh, I answered that question.
Yeah.
I just like to add in here. There's a question that was sent via email, and this question is Dr. Chiu. First, in fact, there are three questions. All are related. First, after removing of GIST, what is the chances of relapse, and does GIST occurs to other parts of the body? And then between the CT scan and colonoscopy, between the CT scan and colonoscopy, which is more recommended for a GIST patient? And the last one is, how often do we need to go for CT scan and colonoscopy? Yeah.
Okay,
Dr. Chiu,
yep.
Before you answer the question, can you tell us what is GIST?
Yep.
Because you haven't tell us yet earlier.
Yep. So GIST is not a common cancer. It stands for gastrointestinal stromal tumor, or GIST for short. The understanding of it is that there's a whole wide spectrum from sometimes not so aggressive to very aggressive, and it can occur anywhere from stomach, small intestine, and also in the colon and rectum area. I have removed those that are very close to the anus. I removed those in the colon itself. So many of the time, there's the biology and aggressiveness depends when we look in the microscope, and then we can determine. So the three questions are quite hard to explain in a few lines, but suffice to say, yes, a CT scan is necessary, just like colorectal cancer follow-up. GIST can spread to the liver and what's not. So we need the standard surveillance. But if the GIST occurs from the colon and it's been removed, then we will also need a colonoscopy. But bear in mind, GIST can occur in the stomach and small intestine itself. Right?
Okay.
Was there another question, Ellie? I missed out?
Yeah. Is the frequency of the CT scan and colonoscopy?
Yeah, I think like all cancers, most of the time, if it's completely cured, then an annual or yearly check is okay. We do have chemotherapy that is required. It's called Gleevec. And sometimes the patient has it before operation and even a few years after. And it's very successful to suppress and control the cancer to prevent it from coming back. But unlike colorectal cancer treatment with chemo or ovarian cancer, where the duration of treatment is short and finite, for example, 6 to 8 cycles over 6 months, Gleevec can be up to a couple of years, 2 to 3 years, or even longer to suppress the tumor. So it's not a standard colorectal cancer per se, but the biology and how it evolves is slightly different. Thanks.
Okay, thank you. Thanks,
Dr. Chiu.
Yeah, thanks, Dr. Chiu. There's another question directed at you for you. What are the immediate or nursing consideration if the rod accidentally slipped out during hospitalization? Is there anything you need to take note of post-operation?
The rod usually is quite stable. There's an end that can fold and remains horizontal. The rods, there are two different sizes, the standard one and there's an extra long one. Now with the rod, usually it's placed over a bag. So I think most of the times when we work with the ostomy nurses, we do stoma change with or stoma teaching with the patients and the caregivers, usually day 4, day 5, when we can remove the rod. Now the challenge comes in when the rod slips away. For example, the stoma opening is very big and patients are very, very big size and the stoma rod comes out. Now, by and large, I think it's quite safe even if it drops out day 3. Generally, wound healing by day 3 is okay. There's quite good sealing of the wound. The problems are when the stoma is created as an emergency, for example, or patients has poor wound healing on diabetes, is on steroids, on chemotherapy, for example, then the rod may need to be longer or patient's very big size. If the stoma rod drops off, don't panic, okay? Just have a good look. Sometimes I've had to go and stitch the stoma in the ward, and this time just a bit of local anesthesia, a couple of stitches, and it's okay and it's whole. There's no real need for any of that if the patient is healed very, very well. By and large, we say we can off the stoma rod day 5, but anything from day 4 onwards is actually quite safe. Thank you.
Okay, thank you. Thank you. This question is for Doris. Can you share the garments that you put up on the slides just now? I let you have some time to find the slides, okay? But there's a question for maybe for Iris about the Coloplast base plate and also a C-shaped tape. Now, this patient mentioned that usually after shower, when you have some contact with moisture and so on, the C-shaped tape and the base plate will show that they are not sticking very well. So if she wants to go swimming and so on, is there anything else recommended?
Okay, so if for swimming, right, if let's say it's a colostomy, we actually have this thing called a stomach cap. Stomach cap is like a round like bag. So you can like as a stomach bag, you can actually attach to your base plate. After that, you can swim. But usually, I advise my patient as time goes by, then you will know when is the time your stomach is active or not active. So you go for a swim, your stomach is not so-called not active. Then you can go for a swim. After that, you can change your pouching system, okay, or you can just change a new stomach bag. So this is like how a stomach cap look like. You see, this is the front where you can click onto your base plate if you're wearing a two-piece system. Okay, so this is how a cap will look like. So from the front, it will look like that. So you can maybe cap it, then you can have a swim for maybe half an hour. Yeah, then you can put back your normal pouching. Let's say if you're using a one-piece bag, you may want to empty your bag first, then you can actually fold, let's say it's a one-piece bag, okay, you can actually like fold your bag like that. You can tape it, like then you can go for a swim. So I will advise to wear like a full suit, like a wet suit for swimming. Yeah, for the C-shape elastic tape, it's made of hydrochloride, it's elastic and skin friendly. So it's not meant to be very sticky. Yeah, but it's very elastic. So this is meant to be very elastic. So usually after shower or maybe after you go for a shower or a swim, okay, you can take actually a dry towel or a cloth or tissue just to dry this area around. And say this is a base plate. Okay, so this is how the C shape being taped right like that. Example onto the body, onto the stomach. Okay, so after shower or after you go for a swim, you can actually dry. So the recommendation for the change of a two-piece is really about 4 to 7 days. One piece about 4 to 5 days. Yeah. Okay, so hope I answered your question.
Iris, I got a question also. Some of my patients like to put charcoal tablets in the stomach bag to absorb the smell. What is your opinion on that?
Charcoal tablet. Can also lah, but it will be a bit messy like you put the charcoal. Then I know like Convatec, another brand they got sell this little like charcoal pack like that. Then
it's called diamonds.
A diamond, you drop it inside, actually you will gel up. You actually gel. But then I got patient they go and buy we have deodorants also, deodorant spray. And then I got some patient they buy those aromatherapy oil, the droplet, they drop a few drops into the bag. Then you'll be no smell already. Yeah. Tablet will be charcoal tablet a bit messy. Then the whole bag will be a black color. Yeah. So a bit difficult to wash off.
Thank you.
For the swimming question, right? I think I can just share my experience. When I go swimming, I actually use a support garment underneath my swimming trunk. So I have a high waist swimming trunk. So first of all, I empty my bag. I wear a two-piece appliance. So I empty my bag, I wear my support garment, and then I wear my trunks over. And so I can be in the pool for at least a couple of hours, and after that, no problem. And you don't really have to change your wafer and your bag. It will still be intact, and you can use it as per your normal frequency. Yeah.
Just to show how the deodorant look like, is something like that. Something like this. Then you can drop 1 or 2. It's lemon smell. Yeah, lemon smell. Yeah, a bit of baby smell, like baby powder smell. So you can drop it inside the bag. Okay, then it will smell a bit like not so the smell won't be so offensive. Yeah, especially if the filter is spoiled already. Yeah.
Okay, thank you, Iris. Doris, did you manage to find the slides?
Yes.
Garment? Yeah.
Just a whole minute, and I also managed to find the vendors.
Oh, okay.
Okay. Actually, the boxer, I use it for the daily wear, and it's not as tight as the support belt. So for the boxer and the support belt, I actually got it from this so-called the wound and stomach care, and I can actually share the address later on in the chat there. Okay. Then for the next one, for the support belt, the middle one, Isoflex, actually use it for exercise. It's very good for ones who are doing like strenuous exercise like walking, jogging, running. It's better to use a support belt. It support very well for the muscle and also the endowment. So for the this Coloplast the Bravo the belt, actually use it for daily. At times when I did not use the unisex boxer, I use that to support my pouch. And it's very good because at times when I have a heavy diarrhea or I have a heavy stool, it actually support very well on my this muscle. So so far I using all these three support garment, and I find it's very useful for me.
Okay, thank you so much,
I will
Dr.
share the vendor's address and the contract.
Yeah.
I will put it at the chat group.
Chat. Okay, thank you so much. Iris, there's a question regarding one-piece and two-piece pouch. So this participant asked about what are some factors that will determine the selection criteria, and under what scenario do you use the moldable ring adhesive or stoma paste?
Okay, so usually as a stoma nurse, we'll do assessment. Okay, I will see what type of stoma. Is it ileostomy, colostomy, or urostomy? Let's say if the patient, like in my case study, the number one case study, where stoma is very budded, opening, in the middle, and then there's no skin fold, no creases. Usually a one piece will be suitable. I will let them choose between a one piece or two piece. Okay, if let's say some elderly patient, they have arthritis, or sometimes I got patient with Parkinson, their hand like not so, the flexibility is not so good. So they cannot clip this, this is a two piece, right? They cannot clip the back so well. Okay, there's no way they can clip it. So I would suggest the stoma is budded enough and then with no problem, no skin fold. I'll ask them to use a one piece flat. But we also have like for challenging stoma like skin fold, creases. Sometimes the stoma is a bit like all these creases. Stoma is a bit flat or retracted. We have a one piece convex as well. Yeah. So one piece is usually the change will be more frequent, maybe about 4-5 days. Two piece you can last longer, about 4 to 7 days, because two piece you can take out the back and wash. So it depends on the patient preference, the lifestyle. Some patient which is more active, they do sports, One piece, sometimes our one piece bag might not have the belt. You see, for this to hook to wear the belt. The all two piece system, all convex system will have a belt. So depending on how active their lifestyle and then whether it is suitable or not suitable. So I'll recommend. And then if let's say they want to take out the bag and wash, like a two piece system. So if they allow them to exchangeable, like one plate, two bag exchangeable use, so it's easier for a two piece system. Yeah. And then for the difference between the moldable ring, strip paste, and paste, all these are skin barrier. So I'll assess. Sometimes if your stoma is very nice, very budded, no crease, no skin fold, a moldable ring will be very suitable. If for patients, sometimes they might have skin fold, right? I mean, they ask them to bend, right? Very deep skin fold. Moldable ring, sometimes I find it too soft. So sometimes I will use strip paste or sometimes the tube paste. So or combine. In very challenging cases where there's creases, stoma, very flush, opening right at the bottom, sometimes I will use strip paste and the tube paste. So all these usually is best to see the stoma nurse so they can do a proper thorough assessment and they can recommend you what type to use. Not all patient stoma is the same. Okay, like it might work for patient A, this method. Okay, and then maybe the moldable will work for patient A. For patient B, maybe you use moldable, you keep leaking. So we will need to do a proper assessment and then to to also advise them what type of Pauci system, be it one piece, flat, convex, two piece, even we have deep convex. Yeah, sometimes, and then all the accessory will play a part, like the powder and spray. Yeah, not all patients will need the patient, the skin very nice, stoma very budded, don't even need to use anything, just the one piece pouch will do. Yeah, and then whereas some patients with a more challenging stoma, we use powder spray, all kinds of skin barrier. So we will do assessment. So if you ask me whether this is suitable, I will need to see the stoma, then I'll tell you whether suitable or not. Yeah.
Okay.
Thanks, Iris. Sorry, Joan. I just want to ask Dr. Ju one question which came through the message. It was, if the stoma is very retracted, do you do a reflection of the stoma?
Difficult question. I think there are several reasons why stoma retracts. Of course, the stoma itself can shrink. Sometimes it's not very healthy at the tip, so it drops back. The second reason is the patient's tummy gets bigger after recover, eat more, so everything gets bigger. And then we find that from a budded stoma, it becomes very flushed or even drops back in and very retracted. I think one of the other reasons, of course, is we just got to make sure there's no other problems. Sometimes there's a peristomal hernia that's occurred, so it looks very retracted, but actually it's the whole hernia bulging out that makes it look like that. So yes, the short answer to that is, if it's very difficult to spout, it's causing problems, then we may consider revision surgery. But revision surgery is not so straightforward. It doesn't mean we just make a hole around the stoma, pull it out, and then it becomes flush to the skin. There's a lot of assessment that we require. Because the honest truth is sometimes we have to reopen the entire tummy to then mobilize the entire intestine to then pull out the stoma, or worse still, we have to then resect the stoma to another area. And of course, in any redo operation or repeat operation, the operation length and duration is much longer. You have to do removal of scar tissue, you have to resect, and there are, of course, risks of the operation. As best as we can, we try not to, unless there are problems that affect the patient and of course the caregivers as well. Yeah, thank you.
Thanks, Dr. Chu.
Thank you. There's a question about what is bending line. I don't know who can answer that. Yeah.
So bending line is where when you sit, right, you bend. You bend, you like crouch or you bend, then you see whether there's skin fold. So if the stoma is created on the bending line, then you have skin fold. And then there's where if sometimes it may leak. So bending line is when you sit down, you bend your belly. Usually next to the belly button. Usually. It means the place where you bend your waist.
Okay. Yeah. So just to ask Dr. Chu, why don't you all do a bit higher or lower? Yeah, is there so that it won't be on the bending line? Is there something that you can share with us?
Yeah, I think there are many factors when we cite the stoma. If we can cite it, that means we do proper stoma marking prior with the stoma nurse and patient able to sit up and what's not, then it's usually very nicely cited. But again, patient may have lost weight prior to operation from cancer. Patient may gain weight after surgery because everything is well nourished and all. So the bending line, the curvature, your girth, of course, alters and it's vastly different. When it comes to emergency operation, we are there's no time for proper stoma sighting. For example, if patient comes in with a perforated intestine, there's a lot of distension for the tummy. There's free gas, there's feces, patient is very sick. The intestine itself might be very shrunken or very swollen from the cause of the problem requiring emergency surgery. And in some circumstances, it's very difficult to pull it out properly on the tummy wall. So we have to then cite it best where it comes out. For us, the factors are, it must be within muscle so that it holds quite nicely. It must not have too much tension, otherwise it gets retracted, it gets ischemic, it's not healthy. And 3, of course, we have to decide, is this a colostomy or ileostomy? And this one requires a lot of on-table judgment. And we, of course, say, sometimes there's no choice. We just got to put it right at the line because of the way technically the intestines lie. So God made us in different ways. There's no foolproof, there's no artificial intelligence to determine it best. But a lot of it is technical, physical, that comes with on-table assessment, unfortunately. Thank you.
Yeah. Okay, thank you so much. I think we have answered all the questions that has been posed on the Q&A as well as the chat group. Oh, there's one that just came in. Can anyone share if there are any exercises that you can do for strengthening muscles due to the parastoma hernia?
Yeah, there is. I think have one pictures wait on the online, but I do not know how am I going to share.
Maybe you can give us the website. Yeah.
That's why I'm trying to
Okay, so
to
she
get it.
actually, Doris actually have this YouTube channel. She went to this YouTube channel. The title is Parastoma Hernia Prevention, then dash core exercise technique.
Yeah, you can find it in the YouTube.
Okay. All right.
Can
Yeah.
Maybe you can just search for core exercises technique for parastoma hernia prevention. I think or pelvic floor exercise, something like that. I think
yeah,
YouTube should have a
it's
lot.
quite good. It just it's not suitable to me, so I didn't.
Yeah.
Yeah,
Oh,
it's very.
you can put it on the chat. You can type it on the chat section.
Yeah.
Yeah.
Maybe I
And John,
can
maybe
just
we
chip in
can,
a few words on this.
Yes.
So I think often pelvic floor and core exercises is not sit-ups, neither is it burpees or star jump, that kind of. Sometimes it just requires you, when you're watching TV, to sit posture upright, 2 feet flat on the floor, arms straight, and then you clench and hold. Yeah? And when you clench and hold upright, you're actually squeezing your pelvic floor muscles, squeezing your core, and then you count 7 to 10 seconds, and you do this repeatedly for about 5 to 7 repetitions. It's actually quite tiring, and when you do that, you find that the pelvis closes, your abdominal wall also gets stronger. The moment you get better and recover, you can even try do abdominal wall planking. You know, planking when you lie on your elbow and you keep your body ramrod straight and your back has to be straight. Now, you can start with 30 seconds, 40 seconds, and this helps the muscle wall take strong, but don't overdo it. The correct posture is important. Okay, so I repeat, actually just sitting when you're watching on Netflix or your YouTube channels, feet flat on the ground, sit upright, hold your fist, and then just clench. And as you do that, your core and your pelvic floor strengthens. Once everything is better, you're fully recovered, you can do just very mild, moderate plank floor exercises. That helps a lot with the core. But don't overdo when you're just recovering. Thanks.
Okay, thank you so much. So I think we have answered all the questions and we are coming to an end of this webinar. So once again, I'd like to thank the speakers for taking their time to be here with us, and also thank our partner Coloplast for supporting OAS. And yeah, just to let you know that there is an upcoming event, which is the World Ostomy Day on 2nd of October. So you will receive more information on that, but look out for this date. If you can, mark it down so that you can join us again on the World Ostomy Day. It's going to be another very fruitful as well as enriching event. So thank you, everybody. Thank you. Thank you for joining us in this webinar. Thank you. Bye-bye. Thank you. Bye-bye. Elio, did you take a picture?
yeah, actually I took pictures throughout. So yeah, I will send it to you, and then I'll send it to Shuling, and she can send it to Dr. Chiu and yeah.
Thanks very much. Thanks.
Okay.
How are you
We
doing?
would like to
Thank you so much.
Are you recovering? Okay.
Who is it? Me?
Yeah. When's your
Oh.
chemo finishing?
Another 2 weeks actually, but
Okay, that's good.
I might have to extend it depending, because my marker is still not the lowest.
Okay.
So I'm actually doing targeted as well as immunotherapy. So I'm doing 3 things at the same time.